Eyelid surgery or blepharoplasty is a procedure that's done on either or both the upper and lower lids. It's a procedure to remove extra skin and fat, oftentimes a thin sliver of thickened muscle that creates hooding of the upper lids. In the lower lids, it's usually a matter of fat removal, skin removal, sometimes using a laser to tighten the skin, oftentimes repositioning the fat over the bone to eliminate the hollowing that one sees in the lower lids. Lately, we've been doing much less fat removal because we've seen patients as they get older that appear to have a hollow look from taking the fat out. So we tend to preserve fat, but we're not afraid to remove it in areas where it's in excess. Patients that are asking about eyelid surgery look in the mirror and feel as if they look tired all the time. Oftentimes they have a heaviness of their upper lids. It's called hooding, where the extra skin and fat sort of cascades over the lashes, and then they begin to look in the mirror and see their aunt or their uncle instead of a youthful face, and that's when they have it done. A blepharoplasty procedure can be done under local anesthesia with sedation, somebody to help you relax. It can be done under general anesthesia. It can be done under just intravenous sedation with local anesthesia, but it's a day procedure. It does not require hospitalization. We measure patients before surgery to see the position of their brow. If you take the top of the brow and measure that distance to the center of the pupil, if it's 2.5 centimeters or greater, you do not need a brow lift. And eyelid surgery does not raise the brow, but eyelid surgery can be done along with a brow lift to remove the brow from its position, reposition it higher, and that creates a more youthful look and opens up the eyelid. Probably the most important time for eyelid surgery is patients in their late 40s and 50s, although we see many people in their 60s. It just depends when they begin to see and feel the things that bother them as they look in the mirror and as it affects their vision. The blepharoplasty, if it's just the upper eyelids, can be done in less than an hour. If upper and lower lids are done at the same time, it's about 2 to 2.5 hours. Typically, there is a moderate amount of swelling of the lids after surgery, and it takes 7 to 10 days to see the final result, and it may be 3 weeks or more depending upon how much is done. Typically, eyelid surgery is combined with laser resurfacing of the fine lines around the eyes. Oftentimes, Botox, botulinum toxin is injected in the crow's feet area to minimize those crow's feet in appearance, but also botulinum toxin placed around the corners of the eyes along the bone will allow the brow to elevate without surgery on the brow, which especially in women is very attractive, and in men as well that have a drooping brow that don't want to have brow lift can get just as much elevation with botulinum toxin with or without a blepharoplasty.